Hi, I'm Dr. Havalana. I'm a medical weight loss physician at the Obesity Solutions at Longstreet Clinic. And I'm here to help you lose weight. We have many different programs within the bariatric division. Some of them are surgical, some of them are not. Sometimes surgery is just not for everybody, and so that's where I come in. Sometimes people tend to gain weight long after surgery, and I can help with that as well. So our medical weight loss program consists of a meal replacement program that's been tried and tested and researched for the past 20 years. It's shown a lot of success, and we're excited to use it. So there's a lot of complications from obesity. You know, overall, as a general person, it can make you feel tired. It can make you feel poorly about yourself. It can make you have less energy. You might not sleep well. It affects everything that you do on a daily basis. By losing weight and not losing muscle mass, you'll be able to feel better about yourself, have more energy, sleep better at night, maybe get rid of your sleep apnea. There are a lot of medical complications related to obesity, including hypertension, diabetes, liver disease, kidney disease, lung disease like sleep apnea and pulmonary hypertension. By losing a lot of the weight, you can actually lose some of the disease. You can take yourself off medications and feel better, spend less, and do well. About a year or two ago, the American Medical Association finally declared obesity as its own disease entity, which has given us the opportunity to treat it more like a disease from a multidisciplinary approach, not only trying to figure out why the obesity happened, but what we can do to prevent it in the future, just like you would hypertension or diabetes. And it helps us assess each patient individually, look at their medications that they might be on that may be making them more prone to gain weight, looking at their daily habits, looking at their activity, kind of looking at a person from all different directions to help them get better. Obesity has become rampant in our country. Back in the 1950s, I think statistics show that about 4 or 5% of the population was obese at that time. Those numbers have swelled to over half the country being more than morbidly obese, more than half the country being obese in general or overweight. And it's a disease that spread into our children. So now there's almost 100% chance that an obese child will grow into an obese adult. It's my job to help kind of prevent that. And so trying to get to this disease is from a societal approach as well as from each individual approach is kind of my goal. There are many definitions of obesity. In general, we go by a standard called BMI or body mass index, which measures, takes into account your height, your weight, and then makes some calculations. If your BMI is 30 or above, you're actually considered morbidly obese, you're considered obese, with a BMI of 40 being morbidly obese. Studies show that when you do have morbidly obese, your mortality or your risk of dying actually increases almost threefold. So this is a disease we really want to work on prevention and control to help the numbers look better and help people live longer. The Obesity Solutions Medical Weight Loss Program can help people feel better and live longer. How do they do that? Well, we can help you lose weight, but it's not always about weight itself. It's about losing inches. It's about increasing your muscle mass and decreasing your fat mass so that that people can metabolize better, get around better. Initially, we start off with a meal replacement program that helps people lose weight very quickly initially, so that during that time we can help them learn what behaviors are causing some of their obesity or what medical problems may be contributing to their obesity, and then kind of attacking it every week, every month to help keep the weight under control. What you'll expect if you join the program will be that you will see me for an initial consultation and an evaluation, and we determine if this program is good for you, and if so, which program within it is a better fit for you. There are two programs in general. One is called the Very Low Calorie Diet, VLCD, and the other one is called the LCD. They differ in calories. LCD differs in that we give you a regular meal during that time. Some people feel like they can't do without food. Well, the VLCD would be a great fit for you. The weight loss expected between the two programs is about 3 to 5 pounds per week with the VLCD and about 1 to 3 pounds in general for the LCD. In about a month's time, you come back and see me and we reevaluate. We do blood tests, we do EKGs, I do a physical exam on you to check to see if there's any complications related to the obesity or many of its comorbidities, including hypertension, diabetes. If it looks like we can take you off some medications, we definitely do that. You will follow up every week with either behavior modification group sessions in general, group sessions where all the patients kind of get together and we talk about a certain topic. And it could be diet, it could be activity, it could be behavior, it could be what are we doing that week and what's bothering you. But it helps us all kind of keep aligned and keep things real to help us stay in touch and keep track of your weight loss per week.
Hello, my name is Sheena King. I am a registered dietitian and fitness expert, and I work for Obesity Solutions at the Longstreet Clinic. I will be working with you throughout the medically supervised weight loss program as your dietitian, group leader, and support system. Our program is a 4-phase approach to weight loss. Phase 1 is screening, Phase 2 is reducing, Phase 3 is adapting, and Phase 4 is maintenance. Phase 1 is screening. That is a history and physical labs, an EKG, a diet assessment, and a behavior questionnaire. We will be looking at all of those different areas to help you decide what program you would like to enroll in. Phase 2 is reducing. We have 2 programs. We have a very low calorie diet and a low calorie diet using meal replacements. They are nutritionally balanced and they will meet all of your nutrition needs during your time with our program. The very low calorie diet is 4 different meal replacements, and we have lots of different options for you to choose from. Every week you order those products from week to week, so you can change. So if you like one thing better than the other, then you can change the different product types. Different program for the very low calorie diet is a 6-week or a 12-week program, and that would be something that you will discuss with your bariatrician at your screening appointment. The very low calorie diet is set up to do 3 to 5 pounds a week. If you will follow the program and you will attend our weekly classes, you will lose in between 3 to 5 pounds a week. The other option in the reducing phase, Phase 2, is a low calorie diet. And that is where you would use 3 meal replacements and you would choose a meal on your own. And as a dietitian, I would help, and the doctor would also help you in making those food choices. And that is a goal of our program, is to help our patients learn how to choose appropriate foods along with losing weight and reducing comorbidities. The low-calorie diet is average about 2 to 3 pounds a week. It's really going to depend on whether you follow the recommendations on the one meal that you would be preparing on your own. Phase 3 is adapting. Adapting is when you're between 5 to 10 pounds of your goal weight. We do have a lot of patients who repeat. If you want to do a 6-week plan or a 12-week plan, you can repeat 6 weeks or you can repeat 12 weeks. And we also have a very flexible system to where if you would like to extend for different amounts of time that we can discuss later, we also have those options as well. The adapting phase is 3 products a day or 3 meal replacements a day with the meal that you prepare on your own. Along with all of the different program options, we're going to be talking about a weekly education class as well. Phase 4 is the maintenance phase, and it is the most important phase for our patients. Maintenance is where you lose your weight and you reduce your comorbidities like high blood pressure. If you have diabetes, we help you get your diabetes under control, losing weight, and just feeling better. So the maintenance program is a very important program, and we have a program set up to where you can leave and come back. It is recommended that you do at least 3 months, and 3 months cycle with us where you would do 1 product a day and come to our education sessions weekly or bi-weekly would be your choice. So the weekly classes are designed around 3 different topics, and you have behavior modification, and you have nutrition education, and you have exercise. We weekly will meet for no more than 30 to 40 minutes. Basically what a clinic day would look like is you come in, you will right before class, about 30 minutes before the actual class that you choose to attend, and you would be weighed and we take your blood pressure, and then we have a 30-minute what we call education session on a different topic every single week. The education topics are broad. We have many modules to choose from. We have a lot of expertise presenters that come in. You know, different type topics are covered every single week. The weekly education classes have a variety of topics. So if you were to come to our weekly education classes, some sample topics that you would hear would be labels, managing stress, how to add a fitness program, behavior, social eating, celebratory eating, sleep, lots of there are a lot of different problems around weight and weight loss and weight management, and we deal with a lot of those on the behavior and the physical activity and the nutrition, those components of the modules. Okay, why are you here? As someone who has reached out to our program, there are a lot of different reasons why people seek our services. I'm very passionate about helping people reduce their comorbidities. Our patients come to us with a lot of different medical problems, and the weight and the weight loss is an important part of that, but reducing those comorbidities is one of the most important things that our practice is very passionate about, helping you get healthy. Feeling better when you get out of bed every day is a very important place to be, and it's important that that you address not just your weight, but what is going on around your weight. And our program can help you reduce those medical complications that are vast, and it affects actually your entire body. So we're passionate about not just helping you lose weight with the different programs and the 4-phase approach to weight loss, but we're passionate about helping you reducing some of the medical problems that you might have. Our patients have come off of their medications, they're sleeping better, they don't have joint problems, they feel better about themselves, they are buying new clothes because they weigh less. And they are just generally happier people. It's important that you address your medical complications of weight, because they don't get better on their own. And our practice is a specialty practice, and we're multidisciplined. We have not just physicians and dietitians. We have nurses. We have behavior specialists, and we can help group support. We can help you not only just lose your weight, but we can help you reduce your medical, your medical problems from the weight. And I'm passionate, and anybody who knows me as a dietitian and a fitness expert, I'm very passionate about helping you feel better. And sometimes that's not always about your weight. It's just about getting control of your life. Why don't we take a look at a summary of our medical weight loss program? Remember, don't do it alone. We are here for you. We have a team of medical professionals that can help you reach your weight loss and your health and wellness goals.
Hi, I'm Janine Whitmire. I'm the Bariatric Coordinator here at Obesity Solutions. Thank you for watching the video. These are the next steps to get started with the program. Please complete the questionnaire after the video, and someone from our office will contact you.